category. So when you look at this across all states, this age group tends to be the group that has the most enrollment no matter what state you're looking at. And so after this segment, I will be sharing this PowerPoint with all of the attendees. And there are some external links that you can click on to see some of this data. And this one, it would be down here in the enrollment by state and age category, which shows you a nice Excel sheet of each state and the enrollment by age group. But again, overwhelmingly, the 25 to 49 age group tends to have the highest enrollment. We think about why this might be. It could be that that is the age group that has maybe some more digital skills as they have grown up in the digital revolution. But that is the overwhelming majority of the age group. When we look at enrollment by service type, you can see that 53% are enrolling with a mobile service type. Just behind that, 45.6% are enrolling with a fixed service type, and that does include cable, DSL, and fiber in that fixed service. So it's important for us to kind of understand who is enrolling, how many people are enrolling, and where they're enrolling from when we kind of talk about the importance of this program. So as we look at eligibility, it's important for us to understand who is eligible for this program. So just a snapshot of some eligibility requirements. So household income, if you're 200% or less in the federal poverty guidelines, participation in certain government assistance programs. So that includes SNAP, Medicaid, WIC, Social Security, free and reduced school lunch programs, the federal Bell Grant recipients, federal public housing assistance programs. Those members of those government assistance programs are automatically eligible for the Affordable Connectivity Program, as well as members of households that receive the Lifeline benefit. So when we look at eligibility requirement, and this is, you have to note that this is selected by the applicant. So this is not selected by any organization, but the applicant themselves when they're enrolling for the program. The majority of enrollments are coming from a SNAP eligibility. So over 19 million. Just underneath that are those that qualify for Medicaid. And then as you go down, you can see that enrollment kind of drops down with household income eligibility requirements, Social Security requirements, and National School Lunch Program. But that is a good number when we look at a national number, but the majority are coming from the SNAP eligibility. So one of the main conversations we talk about ACP and its impact is getting people enrolled in the program. So as of 2022, only 1 in 4 eligible households have enrolled in ACP since it launched in 2021. So when we look at why this is, why it's not 100% of eligible households enrolling, there are a couple of conversations that continue to come up. One being that this is a multi-step process. So this is not somebody that can just go complete an application. You have to submit documentation, which is, there are multiple steps to the process that include being approved along the way. So making it a multi-step process can definitely get in the way of families and individuals who are on a time crunch or just have limited access to the internet in general trying to enroll. The application process can sometimes take up to 30 to 45 minutes if everything goes well. We know that using the internet, there are always issues. So, we can, sometimes that number is probably doubled when you look at how long it might take someone that might not have the advanced digital skills when they're trying to navigate the application process. Also keep in mind that 45% of applications are rejected. When they talk about why these are rejected, some of it has to do with a mismatch. So if your name on a document doesn't exactly match the name that you're on the application, that can create some issues when we're talking about what is considered a household. Are individuals married in the household? What benefits are included? So 45% of those applications are rejected, which can be, deterring for someone to try again. So that could kind of talk as to why there's only a 1 in 4 right now. Also, I talked about briefly documents needed. Not everyone has all these documentations on hand that they would need to either upload or take pictures of to upload into an application process. And that can be a barrier for people who are trying to enroll. And as I mentioned, a mismatch. So if you do get documents uploaded, if you do go through the whole application of taking 30 to 45 minutes, and then you realize that there was a mismatch in one of your documentations, you have to restart the entire application. So it's a little bit not so user-friendly in terms of having to start an application, have some issues with it, and needing to restart an application, which can cause some people to kind of just throw up their hands and maybe not want to go through with the process. And then also it's important to mention that 2/3 of those submitting new or re-verification applications quit before submission because of these issues that they're seeing. We have limited time as individuals, especially as families, working parents. Spending this much time on an application might not be something that they're able to do. So I want to keep that in mind when we talk about ACP enrollment. The other issue that we talk about with the Affordable Connectivity Program on the side of enrollment is the budget. Are there funds available in order to see this program through long term? When we look at this graph that's brought to you by the Tech Policy Institute, you can see that we are scheduled to run out of that funding by sometime in April or through July of 2024. Right now, the remaining appropriations available for disbursement is about $8 billion, coming from that $14.2 billion that was initially funded for the program. So we're seeing a lot of people use it. We're still seeing that more people need to use it, but we're kind of going against this battle of, will there be enough money in the budget to fund this program that's definitely needed? So when we look at some of the issues around the ACP, we definitely talk about enrollment as being one of those issues, but also looking at funding and where we can get that funding, and can we continue to fund this program that has been very beneficial. So some ongoing conversations as I'm talking about with the ACP. So last Wednesday on July 19th, Next Century Cities hosted a congressional briefing in Washington, DC with broadband experts from across the nation. We had an incredible panel and some guest speakers that provided some great insight on the ACP, talking about local impact stories, some challenges they're facing, and then why it's so important. I just wanted to pull out a couple of quotes and comments from panelists that were involved in our briefing. Mike Lynch from the National Association of Telecommunications Officers and Advisors mentioned in his closing remarks, "Don't let this ACP get interrupted. It's too good." Kenya Asley from the city of Baltimore talked about how the ACP has increased competition with internet service providers, which goes hand in hand with affordability for individuals. More competition leads to more affordable prices. And Brian Collins from Buckeye Hills Regional Council talked about seeing an increase in take rate of ACP sign-on. People want it, they just need to know about it. So again, this goes back to our enrollment issues and trying to get as many people signed up for the program as possible, and moving that 1 to 4 number of eligible families up closer to 100%. It's also important to talk about why the ACP is so important. And when we look at just a few, I only added 6 here of the elements that ACP touches. When we talk about broadband, we don't necessarily think about things like healthcare or mental health or tribal lands or workforce development, but the ACP really connects all of these together. So when we look at healthcare and ACP, 44% of telehealth visits in 2021 were related to chronic health issues. So when we look at chronic health issues, they're more prevalent in lower income areas. And being able to access telehealth services for providers either in rural areas where there aren't providers in driving distances or specialists in those areas, or whether you're in rural areas and income is an issue for receiving care. Telehealth visits have been crucial, just not only in healthcare, but in mental health, and trying to get people seen through the pandemic and keep individuals healthy. We talk about mental health for a little bit. The increase in mental health, increased access to broadband services is correlated with more positive mental health outcomes. So what they're seeing is that a connection between individuals online, a connection with therapists through telehealth visits, that just being able to access broadband internet has been correlated with more positive mental health outcomes. So when we talk about suicide rates that are increasing in children and adults post-pandemic, we really see that the ACP is having a big impact on people's mental health and the ability to receive mental health care through telehealth visits. We also look at workforce development. I know that for me personally, there has not been a job that I've applied to since I was maybe 15 that did not have an application that was online. It's very rare that you can go into a store and say, hey, I would like to fill out an application. Most times they're going to ask you to go to their website, fill in the application online. And what does that what does that look like for residents or for individuals who don't have access to the internet? Are they able to apply for jobs and be a part of the workforce? You know, we look at education. Students are increasingly being asked to do work at home with their computers. That requires an internet access. You know, if we're talking about families of maybe 2 to 3 children, maybe more, who are trying to access the same internet at the same time, you're asking for a bigger bandwidth. So increasingly, we are putting a burden on families and children in the education systems to continue to be able to excel academically and keep up with their peers. So quickly, we're going to go through some federal and state highlights. And unfortunately, in the federal side, we're not seeing any movement on new funding. The FCC is in the process of working through the second round of outreach grant applications. And I think one of those grant applications, Herminia is going to talk about in just a couple of minutes. On the state side, wanted to highlight Colorado. Namely because their governor has worked together with state agencies to partner on how to expand ACP's reach. So they're partnering with the Department of Labor and Employment, Department of Human Services, Colorado Broadband Office, Office of eHealth Innovation, and the Department of Education. So again, talking about how the ACP kind of tackles all these different areas. When we look at the states with the highest enrollment as of March 2023, Louisiana tops the pack. I know that's Francella's home state, so she might feel a little proud with that one, 21%. Kentucky and New Mexico sitting at 18%, North Carolina and Ohio sitting at 17%, South Carolina 16%, and it kind of goes down from there. So we're looking to increase those numbers, but it's important to see what are those states doing well that's causing those numbers to increase. And so right now, I'm going to turn it over to Herminia Ramirez, who is the Chief Regional Community Coordinator with the Department of Homeless Solutions and Equitable Communities for San Diego County, California. So she can share a little bit with us about the work that they're doing in their great organization.
Thank you, Stacey. And I'm going to go ahead and share my screen if that's okay. There we go. So hello, everyone. I'm Herminia Ramirez, and I'm the Regional Community Coordinator supporting the North Coastal region in the Department of Homeless Solutions and Equitable Communities with the County of San Diego. And our department houses and is leading affordable connectivity promotion efforts that is possible via grant through the Federal Communications Commission. And so I'll start today by sharing a little bit about our department, and that hopefully will give you insight in terms of why this work is nestled within our department. And then I'll go into a little bit more of what we're doing to promote ACP in our department, in our county. So a little bit about our department. We have 3 offices that form the Department of Homeless Solutions and Equitable Communities. And that department is led by Barbara Jimenez, who's our Community Operations Officer. And then we have our Office of Homeless Solutions, our Office of Equitable Communities, and our Office of Immigrant and Refugee Affairs. And these 3 offices exist to achieve better coordination of existing county homeless and equitable community efforts and serve as a central point of contact and collaboration for outside partners to ensure equity among San Diegans to reduce homelessness in the region, but also to work on advancing equity. And all 3 offices together drive equity, which is why ACP promotion fits so well into our department's mission and the work that we're doing within our department. So to share a little bit more about what we do and how we do it, at the core of our department's efforts is community engagement. So everything we do, including my role as a regional community coordinator, is we represent the regions that we serve. And in San Diego, we're divided up by service regions, and I'm in the North Coastal region, and really taking that to as a way to strategize and really respond to each region within the county, because we are a bit of a large county, to meaningfully and intentionally serve those that we serve. I don't know how many of you are familiar with San Diego County, but here we have a few things that make us unique. We have over 100 languages that are spoken in our county. We have a large military presence. We are one of the largest refugee resettlement sites, and we also have the busiest border crossing in San Isidro. And so all of these components make our county unique to serve. And so when we talk about rolling out efforts to promote programs like ACP, we need to be a little bit more intentional about how we reach those communities who have specific language needs or have these other components like those that Stacy highlighted for us that are barriers. And our goal is to really make sure that we eliminate those barriers. So our team, again, with that community engagement focus and all of our roles, including my own, like I was starting to say, we're embedded out in the community. And part of the work that we do is we have a pretty extensive community health engagement team that counts with the support of our community health worker team. And for those of you who don't know about the community health worker model, it's a long-standing model of bringing trusted messengers from those communities you're intending to serve, bringing them on as part of the team, and having their capacity, their trust to also deliver messages out into the community. So we are going to leverage our permanent community health worker classifications, which is a new program and a new classification in our county to roll out these efforts. But we also are going to contract out part of this work. We know that as a county, we're still a government agency, and that might not be the best way to serve the communities, but we can work with partners, contract some of this work out to make sure that we're leveraging and reaching those communities that we want more intentionally. So our community health worker team, which already exists, and we're just rolling in ACP into this work, are going to provide outreach, education, navigation, and direct support, direct enrollment into ACP. A few of the pictures that you see up there are the types of events where our team will deploy. And it's a small picture, but at the very bottom is our calendar from July. So our team does this for a living. We're community health engagement focused. So we didn't recreate the wheel in a sense, but we just gained ACP as an additional tool to bring out to the communities that we serve and provide these points of access into the Affordable Connectivity Program. So what this looks like a little bit more further is we have 18 community health workers serving the 6 San Diego regions, and we're going to work with our contracted partners to also serve the areas that are a bit more hard to reach or where we feel like we need extended capacity into reaching those areas. So that's a little bit about the how and what we're intending to do. And one thing that has been a staple for us since we began this work is collaboration. And I don't think that's new to any of you, and I'm probably preaching to the choir, but our efforts as we started to roll out ACP were informed by internal partners, digital partners, and our community partners, and each inspired our department's ACP promotion work. Internally, our county already counted with a lot of tools and efforts and capacity working to advance digital equity in our county. Our land use and environmental group, which is outside of our department even, is the team responsible for creating the county's broadband plan, which encompasses way beyond ACP and really focuses on that infrastructure, those long-term efforts. And we, plugged in with our community health engagement expertise and added to that portion of it. And so as we continue to do this work, we're going to be able to cross-thread with our internal partners and ensure we're communicating and actively working together to identify opportunities on how to better serve residents. And that looks different in each department. So our aging and independent services, for example, has digital access tools that we're going to couple with ACP to better serve seniors in our county, just to name an example. And then you all heard me mention community engagement is our core, it's our bread and butter in our department. And so we had to rely on digital partners with a diverse group of experts that are already doing this work. We're already doing this work before our team came on board. And they're the team we look to for the technical components of broadband and increasing internet access. And they are also the partners that we often look for data. So we have our regional group of governments, SANDAG, that created tools that we were able to use to put forth information into our efforts in terms of where ACP outreach is needed the most. And so really looking at data-driven efforts through how we deploy this work out in the community. And then of course, last but not least, our community partners, they really help amplify our trusted messenger approach. So Stacy shared a lot of the barriers, and we definitely see that out of the field. Folks don't trust the ACP. It sounds very markety, especially if it's coming from their internet providers. It sounds like their internet provider is trying to sell them something. And so it often takes someone who knows the program, who can hold their hand and provide that warm handoff and to enrollment, and really carry them throughout the process so that households can see the discount into their bill. And with community partners, you saw our map, our calendar, I'm sorry. And our calendar is filled with invitations from community partners who host events in all of the regions that we serve. And so we basically, again, just rolled HCP into everything we were already doing and working with our community partners. And lastly, just to share a few just best practices, of course, that we rolled into all of our efforts. Our efforts are driven and working to ensure that we're deploying culturally humble and responsive approaches out in the community. That's both via language, but also in the ways that we're creating materials, making sure that reading levels are accessible, and then also creating some visual and audio materials so that anyone who wants to learn about ACP can learn about it. We're leveraging existing partnerships, so not reinventing the wheel, not creating more work for ourselves, but really looking at what's there, what can we build on, and where can we add ACP information to. Those data inform strategies, so working with our partners to generate maps of where ACP outreach might be most beneficial in our county, and then strategizing and prioritizing the communities. We know that we won't reach everyone, but we want to reach those communities where we'll make the biggest impact. And then last but not least is ongoing evaluation of our efforts. So every day that we're out in the field, working with community members, we're bringing back that information to our teams and then adjusting those materials, those tools that we created, and making changes accordingly so that we can help support intentional outreach and promotion of ACP. So that's a little bit about our work, and my contact information is there, and I'll put it in the chat for you all. So we are just starting this work. Our grant is for 2 years, and we hope that ACP does not run out in those 2 years and that it gets refunded. And of course, there's a lot of work happening around that. So we hope that's the case, because this is a really great program in the community. Thank you.
Thank you so much, Herminia. It was great to hear about the work that you all are doing, especially the collaborative pieces and really working within the community. So thank you so much for that. In our last 2 minutes here, I just want to highlight that I will be sharing these slides with you after the webinar is over, and Herminia was nice enough to include her email, and I will include that as well. We hope to see you next time for our next segment, which will be back to school, what's in your broadband backpack, which will be on August 22nd from 12 to 12:30, and you can register with the same link that you used before with Eventbrite, and I'll send that out as well at the end of our webinar. So thank you all so much. A special thank you to Herminia and our Next Century Cities team. Thank you all for joining us. We hope to see you next week or next month. Thank you so much.
Thanks, Stacy.